What if you could scrub your arteries clean, just like a dirty pipe? Welcome, my friends. Professor Vitalis here with your daily dose of wisdom and wellness, where science and experience walk hand in hand. Many people imagine our blood vessels are like household plumbing that can be endlessly polluted and then, with a simple drain cleaner or a quick procedure, flushed out completely. Today, we're going to explore if that's truly possible. It is absolutely crucial that you stay with me until the very end of our discussion today. I promise to reveal the single most effective and realistic strategy for managing arterial plaque, and I will break down the difficult choice between radical lifestyle changes and medication that could fundamentally alter your health trajectory. Let's begin with the problem itself. Atherosclerotic plaques. I've discussed the mechanisms in detail before, so today, let's focus on what they are. Imagine a small formation inside your arteries. It has a core made of fat and lipids, which is often inflamed and can even become necrotic, meaning the tissue dies. This core is covered by a cap, a shell made of dense connective tissue. The longer this plaque exists, the more calcium salts are deposited into it, eventually making it hard or calcified. So why do they form? In a healthy body, blood flows smoothly in what we call a laminar flow. But our arteries are not straight tubes. They branch and curve. At these branching points, the blood flow can become turbulent, creating tiny whirlpools. These whirlpools can damage the delicate inner lining of your arteries, the endothelium. Now, if you also have high blood pressure, this damage is intensified. If you have high blood sugar or insulin resistance, chronic inflammation further injures these vessel walls. When all these conditions meet a high level of low-density lipoproteins, the so-called bad cholesterol, the stage is set for plaques to begin forming. At first, they are insignificant, blocking only a few percent of an artery. But over time, they grow. Once a plaque blocks more than 60% of the vessel's opening, we start to feel the effects. For instance, a 60% blockage in the carotid artery in your neck reduces blood flow to the brain, and you will notice symptoms. This can happen in any artery. We see it dramatically in the legs of smokers, where plaques can block 90 or even 95% of the artery, cutting off blood supply and leading to gangrene. Typically, the first plaques appear in the carotid arteries, then the process often spreads to the vessels of the brain, followed by the coronary arteries that supply the heart. Next is the abdominal aorta, where they can cause a dangerous ballooning of the vessel wall called an aneurysm. Finally, they can affect the arteries leading to the kidneys and, as I mentioned, the legs. But here's a fascinating twist. The body has a remarkable ability to adapt. As a major artery slowly becomes blocked, the body can develop small, alternative routes for blood flow, what we call collateral circulation. When the main path is clogged, these tiny detours expand. Because this process is so slow, a person might build such an effective bypass network that they don't even notice when a major artery, like the internal carotid, is almost completely blocked. I have seen cases where people live perfectly normal lives with a total blockage, their brain receiving blood through smaller vessels routed through the eye socket. However, a much worse scenario, and the most common cause of heart attacks and strokes, occurs when a plaque suddenly ruptures. This usually happens because of intense inflammation inside the plaque's fatty core. The surface tears open, and the body, seeing an injury, immediately forms a blood clot on this ruptured surface. This clot, or a piece of it, can break away, travel through the bloodstream, and lodge in a smaller vessel downstream, completely cutting off blood flow. If this happens in the heart, it's a heart attack. In the brain, it's a stroke. When we look at plaques with ultrasound imaging, we assess whether they are stable or unstable. A stable plaque is typically heavily calcified, dense, and has a smooth surface. It's less of a threat. An unstable plaque, however, is soft, fatty, and has a rough, ulcerated surface. This is the kind of plaque that is a ticking time bomb. Now we arrive at the central question. Can we get rid of them? Some people learn they have plaques and do nothing, carelessly assuming they are safe. Others, just as carelessly, assume there is a magic pill, a supplement, or an IV drip that will cleanse their arteries. The truth is, it is possible to reduce the volume of atherosclerotic plaques, but only by a small, though significant amount, perhaps up to 24%. The first real evidence for this came after World War II. When scientists compared autopsy results of people who had endured long periods of starvation with those who had not, they found that the starved individuals had far, far fewer and smaller plaques. More recently, a fascinating study was conducted by Dr. Dean Ornish. 48 people were put on a very specific diet, a low-fat, ovo-lacto-vegetarian diet. This meant they could eat egg whites and non-fat dairy, but no meat products at all. Only 10% of their daily calories came from fat, and cholesterol intake was extremely limited. They could eat unlimited amounts of fruits, vegetables, beans, and legumes. Alongside this diet, they engaged in at least 30 minutes of strenuous physical activity every day. The results were clear. Those who stuck to this intensive regimen saw a measurable reduction in the volume of their atherosclerotic plaques. But what about medication? Here, the flagship drugs are statins. Statins work by blocking the synthesis of cholesterol in your body. Numerous large-scale studies have confirmed that statins can lead to a reduction in plaque size, again, in that range of up to 24%. But they do something even more important. They stabilize the plaques. This means the plaque's fatty core shrinks, the inflammation subsides, and the surface becomes smooth and strong. A stable plaque is far less likely to rupture and cause a catastrophic event. So, statins not only prevent plaque growth and slightly reduce them, but they also diffuse the time bombs in your arteries. So what is the most effective strategy? An intense diet, strenuous exercise, or taking a statin? The best approach is to combine all three. Let's be realistic. The Ornish diet, combined with daily intense exercise, requires a monumental, almost titanic effort. It's not just for a day or a week. It could take years of this strict lifestyle to see results. I know very few people who are capable of sustaining that level of discipline long term. Therefore, in my view, the most realistic and powerful strategy for most people is a combination of a sensible, balanced diet with reasonable restrictions, regular physical activity, and, if prescribed, the use of statins. This approach is far more sustainable over the many years it takes to manage this condition. It's more achievable for a person to maintain moderate changes and take a pill than to adhere to a rigid, extreme lifestyle indefinitely. Ultimately, if you are strongly against taking statins, that is your right. You simply need to weigh the risks of the disease complications I've described against the potential risks of the medication. The choice is yours. Knowledge only works when you apply it. I'm Professor Vitalis. Stay curious, stay healthy, and never stop learning.